Hi, my name is Joe Newtoff, and today we're going to be talking about PNF stretching, which stands for proprioceptive neuromuscular facilitation stretching. First technique I want to talk about today is the hold relax technique. This calls for an isometrical contraction of the muscle for 8 seconds. It's done for 8 seconds because that's how long it takes for the Golgi tendon organ to relax and allow for you to go into further end range of motion. So this can be done on the lower extremity by using either, for the quadriceps, by using an either towel or a belt. You can pull your knee into flexion up towards your butt and contract your quads for 8 seconds and then relax, and then once you relax, pull it closer into further stretch, and then is performed again with an 8-second isometric contraction. The next technique I want to talk about is the contract relax technique. This is performed with a concentric contraction of the muscle through full range of motion. So for an upper extremity, you can talk about the triceps and the latissimus dorsi. If you bring it back to the end range of motion and concentrically contract downwards through the full range of motion, and then once you get full range of motion, relax, and then bring them into a further stretch. And then again, you're concentrically contracting the muscle downward through the full range of motion. And then you're applying a slight resistance with this hand through the whole process. Now we're going to look at 3 different types of stretching. The first one, we're going to have her lay supine, and we're just going to have the knee flex, the knee extended with the hip flexed. I'm just going to bring them up, and what we observe here is the muscle spindles in the hamstrings responding to the increase in muscle length, which will cause it to stop and keep it there. Now if I bend her knee and do the same motion, again you observe the muscle spindles responding to the muscle tension and muscle increase in muscle length. Now with this next one, we're going to rapidly bring her up into hip flexion, and as you can see, it's a bounce back effect because of the Golgi tendon organ is firing, causing the hamstrings to relax, so further damage is not caused to the hamstrings, because that quick movement and increase in muscle length and muscle tension causes the Golgi tendon to fire and prevent essentially injury to that hamstring muscles. Now when it comes to static versus PNF stretching, static stretching is you find end range of motion and you hold it there for 30 to 60 seconds, and then PNF stretching involves muscle contraction and isometric and concentric muscle contraction. Preferably for the patient, I believe that static stretching is more comfortable because all they have to do is lay there and enjoy the stretch. They don't have to perform any contractions or anything versus PNF. But I do believe PNF stretching is more effective because it increases flexibility and increases motor control, because it is a functional pattern of movement, so that increases it and can go into a further stretch. And that's why I also believe it's more beneficial, because you can go into a further range or further stretch in end range of motion compared to static stretching, and is most favorable for rehabilitation. Now for part E, I'm just going to perform the 3 different techniques. The first technique is a hold relax technique. We bring the patient up to end tension. I'm going to ask her to contract, isometrically contract her hamstrings for 8 seconds. So go ahead and contract, and I'm going to hold resistance here. And then once the 8 seconds is up, I will tell her to relax, and I will pull her into a further end range, and then again ask her to do an 8-second isometric contraction, and then relax, and then go further. The next technique is a contract relax. So we go to end range of motion, and she's going to concentrically contract her hamstrings through the full range of motion while I apply mild resistance. So contract, 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 all the way down, relax, and then I'm going to bring her up in a further end range motion, and again she's going to contract contract, 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 and then relax, and then it'll go further. And the last PNF stretching technique is a hold relax with agonist contraction, agonist muscle contraction. So as we look at it here again, it's almost the same as a hold relax. So I'm gonna bring it to end range. She's gonna contract the hamstrings for 8 seconds. Once the 8 seconds is up, and I'm gonna ask her to contract her quadriceps. And by doing this, when she contracts her quadriceps, go ahead. I'm gonna push further. That'll inhibit the hamstrings to allow for further range of motion. And then again, she's gonna push with the hamstrings isometrically for 8 seconds. While apply resistance, and then she'll fire her quadriceps. Go ahead, fire her quadriceps, and then go into further range of motion. These are some examples of PNF stretching.